I think watching this video is relevant to when I become a social worker because there are so many correlated things with mental health, incarceration, substance use. I mean, it just kind of is this cycle of lower socioeconomic status, lack of community resources, lack of facilities, or supports that are able to have a restrictive setting to a less restrictive setting, and then to have a community outreach program. I think after watching this video and hearing about how much funding was cut off in Chicago and how it impacted the budget by increasing spending in some areas, I think it should have been a lesson learned. And I feel like that was not learned enough in our society, and I wish that more could be done about it. And I think that it's really alarming and eye-opening about how many people need mental health services. I think there's such a large amount of people, and whether they have co-occurring with substance use as well, whether they've been incarceration, which I know there's an increase in incarceration rates, generally can be linked with substance use, generally homelessness. So there's an interconnected network between that. And I think it's shown in this video. And I think that um, people that are incarcerated lack other supports and services upon discharge, just like we see in mental health, just like we see in substance abuse. So, as a social worker, even if I'm not working with people that are incarcerated, it's likely I'm going to work with people who have been incarcerated or experiencing other things that most people with mental health or mental health concerns experience. And my role as a social worker is to advocate for those individuals and connect them with resources. And I think that there's so much more that can be done, and working in a hospital in the emergency room for my practicum has really opened my eyes to the lack of resources that we have and how much more can be done. I think that there's still so much to be solved regards to mental health and mental health resources, and I'm concerned that not enough is being done.